Hi, my name is Brittany Craig. I'm a registered dietitian nutritionist. I practice in New York City and I specialize in oncology. Today, I'm going to discuss with you how nutrition may play a role for you or a loved one who is experiencing head and neck cancer. The dietitian can play a big role with patients that are experiencing cancer. We work a lot on making sure that they're eating adequately and they're finding ways to nourish their body appropriately despite their cancer and maybe potential side effects that they're experiencing from the cancer treatment. We work with head and neck cancer patients pretty early on in the journey, typically when the patient is about to start their treatment, whether it's chemo, radiation, even surgery. I'm often consulted to speak with them just to discuss how important it is to be eating, making sure that they're keeping their weight stable, what to maybe expect in terms of eating when the treatments occur. It's really important for these patients to work with the dietitian because they truly often have a very difficult time eating well. And they're they're at very high risk for malnutrition because of such severe weight loss. Oftentimes these patients lose their appetite. So eating is just not on the forefront, but it's very important that they continue to nourish their body. When a person with cancer comes to meet with us, one of the dietitians, for the first time, they will be asked a lot of questions by us. We will ask them about their diet currently, in the past, any dietary changes that they've had, if they've had any changes in their appetite, if they've had any weight loss or weight gain recently. We want to know all of that to help us, create a picture of who this individual is and what we might expect to see moving forward. For example, a person that maybe is eating great appetite, no actual effects so far from the cancer, they eat a relatively healthy diet, they might not need to do so much at that point in time. But another person who maybe has lost 20 pounds, whether it's from the cancer itself or if they're having difficulty swallowing, all those things we need to know so that we can intervene right away and make sure that this person is not at risk for malnutrition. For a person with head and neck cancer, especially those that are going through cancer treatment, I'm following up with them pretty much weekly and seeing how they're eating, if they've had any changes, meaning if any of their side effects from treatment are causing them to have any difficulties with eating. Those are some very important things for me to know, especially their weight too, any weight loss, and then what we can do together to try our best to improve those symptoms. But weekly is very important, if possible, during treatment. If not, and they're doing pretty well, then maybe monthly, that might be okay. It really depends on how significant the person's side effects are. If they're having a really hard time eating, then I think the gold standard, my own subjective gold standard, is that they see us weekly. These patients, when we're working together through their treatment or just maybe their struggles with eating after treatment or after surgery, we are making sure they're not losing weight. So it depends on the individual, but a lot of times it's checking their weight regularly, making sure it's stable, if not improving if they've had a significant amount of weight loss. I'm keeping track of how they're eating, how much they're eating in regards to calories and protein, to make sure that they're getting enough for their body. I do look at their blood work too. That can alter a little bit, just maybe depending on the treatments that they're on as well. But that's still something that I look at. I work with them through the process, through their whole chemo radiation treatment. And then really until I feel like they're starting to just be back to normal. For a person that has head and neck cancer and is looking for more resources regarding nutrition or trying to find a dietitian, I would first suggest that they ask their cancer center if they can refer them to someone. So if someone does not have access to a dietitian, I would suggest that they ask their oncologist if there is a referral out there that they are looking for that. Our specialty of dietitians and nutritionists working in cancer centers, I believe, is becoming more common, but I know that it's still growing in regards to all cancer centers offering nutrition support. Even if a person's cancer center might not have a dietitian that they might see regularly, there usually is always that resource there. And if they're not aware of it, they should definitely ask their medical team, their doctor, their nurse about what options they have for nutrition help and assistance. I do believe that a person with cancer really should see a registered dietitian because we are the nutrition experts. We are the science background of nutrition. That's where our education comes from. So a person with cancer, I really believe, needs that. So they should look up someone that has an RD or RDN in their title. That means registered dietitian nutritionist. Someone that may be a nutritionist but might not have that same rigorous education background cannot use RD or RDN in their title. If an insurance, provider is not offered to the patient in regards to nutrition services covered, I would suggest, they can find sound information online. It's just being very mindful of where your information comes from. So maybe a hospital center would have some good information. I think the most rewarding part about working in this head and neck cancer population is it's really inspiring to see these patients go through such a incredibly challenging time in their lives and watching them pull an inner strength, whether it's their own strength, their strength from their family and friends. These patients, always amaze me in terms of how they handle it. Getting a diagnosis like this can be really scary. But what I love about my field and my role is that I can at least always be there and provide some reassurance to these patients that we're here for you. We're going to get you through this. You're not alone, and we're going to continue to find ways for you to just get through this. If you or someone you love is affected by head and neck cancer, remember that you are not alone. Together, we are made of more.